I'm Dr. Grimm. I'm the general surgeon here at Van Diest Medical Center, and I grew up in northern Iowa on a farm. I then went to private college in Indianola, Iowa called Simpson, and then I moved on to the University of Iowa for medical school. I did my surgical training in Youngstown, Ohio, and during my medical career, both medical school and then eventually surgical training, I knew I wanted to come back to small towns. Having grown up in rural Iowa, I like the Midwest people, I like agriculture and the people that live around those small towns. So I also learned in that time that I really felt that rural medicine was a unique place to practice, with the chance to provide great care and quality care and high standards of care locally for people, so they don't have to travel if they don't need to, and they get the same care they would get if they lived in a big city. So after I got done with my residency training, I then went to a critical access hospital in Wisconsin and was there for 8 years, a place very similar to Van Diest. And then spent a few years at a smaller hospital in Minnesota, and eventually showed up at Van Diest Medical Center in 2017. I am a general surgeon, which means I do a lot of different things. Part of the fun of general surgery is there's lots of variety. I do lots of colonoscopies, upper endoscopies, hernias, appendixes, gallbladders, lumps and bumps, do some minor gynecological procedures. Really enjoy that wide variety. One of the things I always kind of try to explain to people is that surgery is kind of like being the mechanic of the body, and that's why I like it. I get to use my hands and fix a problem and see what's actually being done. So I really enjoy that part of surgery. So one of my practice philosophies is I try to treat everyone as if they were a family member. I like to really make sure people are getting the best quality care locally, but I also am very aware of what our resources are at our facility. And so, though I may have recommendations that are something our facility can't provide, I'll be very upfront and tell people that. Provide them the help of getting to where they need to go or want to go. But I do believe we should try to keep as much care as we can locally, and so I do that to the best of my abilities. At an initial consultation with me, we kind of cover a couple different things. I do think it's a very important time for me to just meet a patient and understand them and potentially their family, them to get to meet me and ask me questions, because part of surgery isn't just the actual technical part of fixing whatever the problem is, but a lot of it also has to do with your healing afterwards and your confidence in the care that you're going to receive. And so that's part of the initial consultation, is setting up that relationship.